Hi, Dr. Tracy Tyson, board certified pediatrician, and let's talk about aluminum in vaccinations. So, this is a hard topic to talk about because it is extremely complicated, and I think people get into the weeds of medical data. So, I want to talk about some basics. I'm not going to give you a ton of statistics because I think that doesn't necessarily matter for this conversation. This is for those who are going, what is the deal with aluminum? So, let's talk about it. Aluminum phosphate, aluminum phosphorus, aluminum sulfate are salts of aluminum. So the word heavy metal gets thrown around a lot and makes it sound really ominous and scary. Like, why in the world would you put a heavy metal in a vaccination for a baby? It sounds crazy, right? But I want you to remember that iron is a heavy metal, yet we need a certain amount of ferrous sulfate or iron in order to create healthy hemoglobin and carry oxygen through our tissues. Aluminum sulfate and aluminum phosphorus are naturally occurring salts that are in a lot of what we consume. There is some in our food, there is in our soil, there is some in breast milk, and it's naturally occurring in lots of different areas. Yes, there is a difference when you consume something but injectable, but we also have 100 years of data to fall back on what is safe and what is not safe. So first of all, why is it used to begin with? So it is one of the longest used adjuvants in vaccinations since the 1920s and is used worldwide in vaccinations. An adjuvant is a chemical that when it is in the vaccination, it creates a little bit of irritation within the tissue and the bloodstreams to signal the body that, hey, there's something going on here. Because if you just inject a little dead piece of a virus or bacteria, the body is smart enough to know that that's not going to hurt it. It'll just let it go. If you ever wonder why you get exposed sometimes to a virus and you don't really get sick, it's because if the virus is weakened by the time it gets to you and it doesn't cause cell damage or irritate your body, the body's just going to let it go and not do anything with it. Well, that's what happens with vaccinations if there isn't an adjuvant or an irritant to alert the body. It's like an alarm system. Ding, ding, ding. There's something wrong. Can you come in with your white blood cells and elicit an immune response so that you can make immunity to it? There's been multiple different adjuvants used. Thimerosal is one. And so this has been used for quite some time. It started to become a concern in the non-medical community because of some studies that showed that there was toxicity with aluminum in certain countries in the world when it came from their water or their soil. So that is understandable, right? There is a reason that a lot of these studies were done because we need to understand exactly how any substance that we put into our body, how was it excreted? How do the tissues get rid of it? What are the long-term complications? Does it build up in any place in the body? We have that evidence now. So there is a ton of evidence as close as 2025 where they looked at, is aluminum salts safe to still be used as an adjuvant in pediatric vaccinations? And it's an overwhelming yes. The reason it's an overwhelming yes is because there has been toxicity not from vaccinations. We know what is the upper limit of normal. So 2 grams a day of aluminum salt is the upper limit of normal of what a child's body can get rid of safely within 24 hours. So whenever you get exposed to aluminum, whether you take it in or it's injected, your body needs to get rid of it, right? It can't stay in it. And that's how much a child is able to tolerate within a day. The entire US vaccination schedule, if it was given all in one day to a child, would not equal the amount that the body is able to get rid of within one day. So we would not even hit toxic levels if we gave it all in one day, yet we give it in very small amounts separated by several months over a few years to allow a little bit of irritation to the immune system, let it heal, little bit of irritation to the immune system, let it heal so that the body is slowly building up immunity over time while also allowing the body to get rid of any of the substances from the vaccination. This has been studied worldwide. So the most recent study was in Denmark. It was published in 2025 and it had over 2 million children in it, where they actually looked at 10 different chronic diseases and were they increased in children who had received the standard vaccination schedule, no vaccinations, middle of the ground. They did not find any statistical differences in any chronic illness in children who had received a standard vaccination schedule using aluminum. So this has been done over and over again. The United States has a study with over 500,000. There is at least 12 studies that you can find that are meta-analysis where they look at all studies to prove that the dosing that we use in aluminum for vaccinations is safe. It's necessary to get the vaccination to work. And as of now, the science shows this is the best adjuvant to use for most vaccinations. You have different vaccinations that need adjuvants or don't need adjuvants. There is a partially live flu vaccination in the nose or flu mist that does not use that as an adjuvant because it is a live virus. You don't need the adjuvant because it lives in the nose, and then as soon as it hits 55 degrees, it's killed. And so that is one way. The mRNA vaccinations did not need the adjuvant of aluminum in there. So some of the things we do to try to decrease the amount of aluminum given to children is combination vaccinations. So when your pediatrician, family practice provider offers your child a combination vaccination, there's two reasons for that. Well, really three. The first one is there is less preservatives and less of an adjuvant needed. So you're talking one adjuvant versus like 12. It's also one injection site, so there's less issue at the injection site when you're giving multiple vaccinations in one injection. It also does increase compliance because when you're talking about a child needing that many shots, the compliance would go way down. So that's why the combination vaccinations are so popular, because of those three things. So again, there's a lot of noise about aluminum and vaccinations, and there should be, but within reason. So every study we have that really looks at the risk of aluminum in children has shown that it is safe, necessary, and effective at preventing disease when used in vaccinations. So I'll link some studies below, but again, remember that as a layperson, so if you yourself are a layperson and you don't have a degree in biochemistry or statistics or medicine, again, take the studies with a grain of salt. It's really hard sometimes to understand them, but I want you to know where I'm getting my information from because I think that's extremely important. Read them if you want to, ask some questions, talk to your child's doctor about why aluminum is the best adjuvant right now in certain vaccinations and what the studies show it be safe and effective. If you have any questions, let me know. Take care.